Alert: 12 silent symptoms of colon cancer that you cannot ignore. Colon cancer is one of the most dangerous and deadly cancers, not because it is impossible to treat, but because it often goes unnoticed until it has reached an advanced stage. Every year, thousands of people receive a diagnosis that could have been prevented with early detection. The reason? The symptoms of colon cancer can be incredibly subtle, easy to overlook, or mistaken for other, less serious conditions. Many people brush off these warning signs, attributing them to minor digestive issues, diet changes, or even stress. But ignoring these symptoms could be a fatal mistake. Colon cancer doesn't appear suddenly, it develops gradually, giving off silent signals that something is wrong. Recognizing these early signs could mean the difference between life and death. If you or someone you love has been experiencing any of the following 12 symptoms, it is crucial to take them seriously and seek medical attention immediately. 1. Persistent changes in bowel habits. Your digestive system is one of the most reliable indicators of your overall health. When your bowel habits change suddenly and remain abnormal for weeks, it could be a sign that something is interfering with your digestive process. Many people experience occasional constipation or diarrhea due to diet or stress. However, when these issues persist for more than a few weeks, it could be a sign of a larger problem, such as a tumor growing in the colon. Tumors can obstruct the normal passage of stool, leading to changes in frequency, consistency, and ease of bowel movements. If your bathroom habits have changed significantly without a clear reason, don't dismiss it, talk to a doctor. 2. Blood in stool. Even a little is a big deal. One of the most alarming symptoms of colon cancer is rectal bleeding. Many people assume that blood in the stool is caused by hemorrhoids or anal fissures, but colon cancer can also cause blood to appear in bowel movements. Blood from the colon can be bright red or dark and tarry. Bright red blood often indicates bleeding from the lower part of the colon or rectum, while darker blood suggests it may be coming from higher up in the digestive tract. Regardless of the color, any unexplained bleeding should be taken seriously and evaluated by a doctor. 3. Unexplained weight loss. Losing weight unexpectedly might seem like a good thing, but in reality, it can be a warning sign of something serious. Colon cancer can interfere with the body's ability to absorb nutrients, leading to rapid, unexplained weight loss. Additionally, cancer cells consume more energy than normal cells, leading to increased calorie burning. If you've been losing weight without changing your diet or exercise routine, it's time to get checked out. 4. Constant fatigue and weakness. Are you feeling exhausted all the time, even after a full night's rest? Colon cancer can lead to chronic fatigue due to internal blood loss. Slow, continuous bleeding in the colon can cause anemia, reducing the number of red blood cells available to transport oxygen throughout the body. Anemia-related fatigue is different from ordinary tiredness. It often leaves you feeling drained, weak, and unable to focus, no matter how much rest you get. If your energy levels have been consistently low, it may be worth investigating further. 5. A feeling of incomplete bowel movements. Do you often feel like you need to go to the bathroom but can't fully relieve yourself? This could be a sign that a tumor is partially obstructing the colon, preventing waste from passing through properly. This sensation, known as tenesmus, can make you feel like your bowels are never completely empty. If this feeling persists, it may be time for a colonoscopy to rule out any underlying issues. 6. Abdominal pain, cramps, or discomfort. Many people experience occasional stomach pain, but persistent or worsening discomfort should not be ignored. Colon cancer can cause sharp pain, cramping, or bloating due to obstruction or inflammation in the digestive tract. If you frequently experience unexplained abdominal discomfort that doesn't go away with typical remedies, consider seeking medical advice. 7. Narrow or thin stools. A sudden change in the size or shape of your stool can be an indication that something is narrowing your colon. If your stool consistently appears thinner than usual, like a pencil, it may be a sign of a tumor restricting the passage. While occasional variations in stool shape can be normal, persistent thin stools should not be ignored. 8. Constant gas and bloating. Gas and bloating are common digestive issues, but when they become excessive or chronic, they could be a warning sign. If you constantly feel full, even after eating small meals, or experience prolonged bloating, a tumor could be blocking the passage of gas in your intestines. Bloating that doesn't improve with diet changes or over-the-counter treatments should be investigated further. 9. Sudden aversion to certain foods. Some colon cancer patients report that they develop sudden aversions to foods they once loved. This can happen when the body struggles to digest certain foods due to tumors in the digestive tract. If you find yourself unexpectedly repulsed by foods that were once part of your regular diet, it could be a sign of an underlying issue. 10. Frequent nausea or vomiting. Colon blockages caused by tumors can lead to nausea and, in severe cases, vomiting. When food is unable to pass through the intestines normally, it can create a buildup that causes discomfort and nausea. If you're experiencing frequent nausea or vomiting without an obvious cause, it's important to consult a doctor as soon as possible. 11. Iron deficiency anemia. Iron deficiency anemia occurs when the body doesn't have enough iron to produce hemoglobin, which carries oxygen in the blood. Many people with colon cancer experience anemia due to slow, internal bleeding. Symptoms of anemia include fatigue, weakness, pale skin, and shortness of breath, dizziness. A routine blood test can detect anemia, sometimes even before other colon cancer symptoms appear. If your doctor diagnoses you with anemia without a clear reason, further testing may be necessary. 12. A persistent feeling that something is wrong. Some cancer patients report having an unexplained feeling that something was off long before they were diagnosed. If you've been experiencing multiple symptoms and something just doesn't feel right, listen to your instincts. Your body often knows when something is wrong. If you have a persistent sense that something isn't normal, don't wait, get checked out. The importance of early detection. Colon cancer is one of the deadliest cancers, but it is also one of the most preventable. Regular screenings, such as colonoscopies, can detect polyps before they turn into cancer. When caught in the early stages, colon cancer has a high survival rate. Ignoring the warning signs could mean the difference between life and death. If you or someone you know is experiencing any of these symptoms, don't wait, schedule an appointment with a doctor as soon as possible. Take action now. Colon cancer does not discriminate. It can affect men and women of all ages, especially those over 45. If you are at risk or have a family history of colon cancer, regular screenings and paying attention to early warning signs are crucial. Your health is in your hands. Don't ignore the silent symptoms. Speak with a doctor, get tested, and protect yourself from this silent but deadly disease. Medical disclaimer. This article is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you experience any concerning symptoms, consult a healthcare professional immediately.